Articulation disorders affect many individuals, influencing how they communicate with the world around them. Understanding the changing perception of these disorders across different stages of life is key to fostering inclusivity and support. Perceptions of people with articulation disorders change across the lifespan due to various factors such as developmental stages, socialization and peer relationships, and also education and awareness. So as children grow and mature, they become more aware of social norms and expectations, which leads to changes in how they perceive people with speech difficulties. It was talked about in posts, like when they are in preschool, it's found cute, but then when they enter second, third grade, peers start to realize and may think that their classmates are odd or different. And then we have socialization and peer relationships. So as children interact with peers, they learn to evaluate themselves and others based on shared experiences, interests, and communication styles. This influences their perceptions of individuals with articulation disorders. And then education and awareness. As people learn more about communication disorders, they may develop a greater understanding and empathy for those affected. And there's changes in perception that can have an impact on individuals with articulation disorders. And positive changes include increased acceptance and empathy. So as individuals become more aware of the complexities of communication and the diversity of human experience, they can become more accepting and less judgmental. And then greater education and awareness can lead to increased empathy and understanding towards individuals with speech difficulties, reducing feelings of isolation and stigma. And then there's negative changes, which includes increased scrutiny, stigma, and self-consciousness, and then increased anxiety. As individuals become more aware of social norms and expectations, they may pay more attention to minor articulation errors, leading to increased scrutiny and criticism. And then the negative perceptions of articulation disorders can lead to feelings of shame, embarrassment, or self-consciousness in individuals who struggle with speech difficulties. And then there's increased anxiety. The fear of being judged or rejected can lead to increased anxiety in individuals with articulation disorders, affecting their confidence and self-esteem. And I think anxiety can be something that everybody experiences. So on top of an articulation disorder or some kind of speech impediment, anxiety can be a lot worse because of that. I remember in high school, I hated standing up and speaking in front of people, like if we had to memorize a poem, because I had a little stutter, and I still kind of do sometimes, but I've accepted it now. But in high school, it was extremely embarrassing, and I would have anxiety before going and speaking in front of the class. So to mitigate the negative impacts, it's essential to promote education and awareness, foster inclusive environments, encourage self-acceptance, and provide support services like speech therapy or counseling or support groups that can help with coping skills. The way teachers approach speech difficulties can significantly impact how students perceive themselves and their abilities. Positive reinforcement and inclusive attitudes can foster a more supportive environment. The behavior of peers towards individuals with articulation disorder can either perpetuate stigma or promote acceptance. Positive peer relationships and inclusive behaviors can help reduce stigma. Self-perception is closely tied to how individuals feel about themselves and their abilities. So building confidence through self-acceptance, self-advocacy, and supportive relationships can help individuals with articulation disorders develop a more positive self-image. And it's essential to recognize that perceptions of individuals with articulation disorders may vary greatly across the lifespan, influenced by complex factors. By promoting inclusivity, acceptance, and understanding, we can work to create a more supportive environment for everyone.